can curcumin help your chronic pain or your chronic fatigue? I'm Dr. Younger. I'm director of the Neuroinflammation Pain and Fatigue Laboratory, and I want to present some findings from my laboratory and talk about the work I've been doing with curcumin, particularly investigating its ability to help systemic inflammation and inflammation in the brain and helping chronic pain and fatigue. So I want to discuss when curcumin might help and how it might help your condition. So about 10 years ago, maybe a little bit longer, I became really interested in researching treatments for pain and fatigue that didn't require a prescription. And the reason I did that is because I saw just how long it takes to develop new drugs for things like fibromyalgia or chronic fatigue syndrome or Gulf War illness. It takes about 15 years from when you identify a new potentially helpful molecule to when you can get that commercialized and available to people. 15 years, and that's if that molecule is successful. Most drugs fail along that 15-year path, and that's really too long to wait. So I wanted to do research on things that people can use right now while they're waiting for that big treatment to be developed. So I have a short list of candidates, and I've had this for quite a while. These are botanicals or supplements, and I made the short list if they met the following criteria. So they had to have some kind of novel anti-inflammatory effect, because I think a lot of the conditions we're dealing with chronic pain and fatigue are based in types of inflammation. They have to be able to cross the blood-brain barrier because I believe that these conditions are driven not by inflammation necessarily in your body, but inflammation in the brain. And then they have to have a long history of safe use. I don't want to be trying new experimental compounds in general. I want to look at things that we know are going to be mostly helpful and they don't carry a lot of risk with them. So there's quite a few treatments that meet those criteria, or quite a few agents or botanicals that meet those criteria. And I started with curcumin. And so the curcumin story starts with turmeric, and that's because turmeric is the spice where you find curcumin. So turmeric is that orangish, yellow orangish spice. You probably have it. It's used in a lot of curries. So it's a very popular, very easy to get spice. It's been used for thousands of years for cooking and for medicinal purposes and for quite a few other reasons as well. The main health agent in turmeric is curcumin. So when you eat turmeric, you're going to be getting a little bit of curcumin, and we believe that when it's been used for thousands of years for helping inflammation and pain and things like that, we believe it's the curcumin in turmeric that's been driving those benefits. So really, we are looking at curcumin as something that can help inflammation and help some immune dysregulation. So does it help chronic pain? It does look like it does help pain. Now, curcumin is not an analgesic. It's not a pain-relieving substance, so it's not like an opioid. You can't throw a capsule back when you sprain your ankle and have your pain go away or your headache go away 45, 50 minutes later. That's not what it's designed to do. This is more about correcting long-standing chronic issues. So it's not an acute effect. It's a chronic effect. In terms of the type of pain, I don't think it doesn't target pain per se, and so I don't again see it as a pain-relieving agent, but it's really targeting chronic inflammation. And so if your pain is due to some kind of inflammation in the body or in the brain, I think curcumin has a chance of helping. It's been researched for arthritis, and so that, arthritis always involves some type of inflammation, and so that makes sense. And I think in conditions where it's neuroinflammation pain, things like fibromyalgia, where the pain is being driven by some inflammatory dysregulation in the spinal cord or brain, curcumin has a chance of helping. And so I do think it can help with pain. I've seen that in my research, and there are other reports as well that it can help. Generally, I think the more widespread your pain is, the more body regions are affected, I would say the greater the chance that curcumin could help that type of pain. But it can also help with localized inflammatory pain as well, if it's arthritic pain, something like that. So yes, it could help that pain. Now, fatigue. Fatigue is more interesting, and I'm less sure of its effects on fatigue just because there's fewer studies. Now, I've seen in my research that it is helping fatigue, but these are very small studies. I hope to get more information about that as I run more clinical trials. Now, we know that it helps exercise fatigue. There's many studies on that. And so I know that curcumin does help fatigue, but we don't know if it helps specifically myalgic encephalomyelitis chronic fatigue, ME/CFS type fatigue, or fatigue that comes with fibromyalgia or Gulf War illness because there's not enough clinical trials. A lot of people who have fatigue, it doesn't have anything to do with inflammation. It may be a vitamin and they may have anemia. And in those cases, I don't think the curcumin is going to be tremendously helpful in those cases. But if you have inflammation-caused fatigue, I think curcumin is likely to help. So it's my hypothesis that curcumin taken daily can help your fatigue if you have ME/CFS or fibromyalgia or Gulf War illness, but we don't know for sure. I have some evidence with Gulf War illness, but I haven't run the clinical trials for fibromyalgia or ME/CFS. And so I can't say it's likely to help, but I suspect it would. Those are different things. Now, how long does it take to experience the effects? Again, this is not fast. With most of these botanicals, especially where we think it's correcting and kind of a dysregulated inflammatory system, it's going to take about 2 months for you to know if it's actually helping. And so one of my greatest points of advice, if you do try curcumin, is you have to give it time. If you're into week 3 and you haven't noticed anything, don't give up. Unless there's side effects that are driving you to stop. But if it's just a lack of efficacy, you have to keep going. These things take a while. If you're changing something that you've had for months or even years, you need to give it time to be corrected. So give it 2 months, 8 weeks before you make a decision on whether it's working or not. Again, it's not like taking aspirin. It's not something where you're going to feel instantly better when you take it. And that's because most of the over-the-counter drugs you take, they target specific receptors and they block something, and they block something acutely. And that's just not the way that these kind of more botanical-oriented agents go. I think that's a good way to put it. They still target receptors, but it's really targeting a chain of events. It's not just hitting a receptor and blocking it like it would be like with an opioid. Dosage. So the typical dosage is around 500 to 1,000 milligrams. That's what's used in most human studies. I think that's a good range to work in. That's where I find in the work that I've done, that's the range where I've seen some beneficial effects for pain or fatigue. I think this is a case where more is not better. I would caution about going over 2,000 milligrams, especially getting to 3,000. We are testing that to make sure that those aren't more helpful, but I think as you get closer to that 2,000 or 3,000 milligram per day level, it's more likely that you're going to have side effects. And I've definitely seen that. So really, especially starting off, I would suggest 500 milligrams a day or 1,000 milligrams a day. And you can talk to your physician about a proper dosage, or a naturopathic physician or someone. The side effects, most of them are not serious, but there are a few to watch out for. So most likely your side effects are going to be gastrointestinal. So some people definitely get diarrhea with curcumin, or they get nausea. In those cases, lower the dose. That's usually the ticket with resolving those. Some people get headaches if the dose is too high as well. So if you get GI stuff, if you get headaches, lower the dose, and those side effects would likely go away. You can see that your stool is yellow. That is not a big deal. That's something that could happen. I don't think it indicates a particular issue. If it's bothersome, you could try reducing your dose for that as well. The big thing with any agent, there's nothing particular about curcumin, but anything that you're taking, whether it's a drug or a supplement, you have to know the symptoms of an allergic reaction or anaphylaxis. If you get a skin rash after you start taking this all over your body, or if you feel that your breathing's getting really fast and your heart rate's getting fast and your breathing's getting shallow, heart rate's up, you feel confused, if you feel like it's hard to breathe, that could be an allergic reaction. You should probably go to the emergency room for that. Again, I mentioned that with anything that you take, even new foods, there's nothing particular about curcumin that makes it allergic. So I do not expect really anyone to have an allergic reaction, but since you can have allergic reactions to peanut butter or aspirin or corn, tomatoes, you can be allergic to anything. And so I have to mention that even though there's no particular reason to look out for that with curcumin, just know what that looks like. So who should not take curcumin? If you have a blood clotting disorder, I would not take curcumin. If you're taking blood thinning medication like warfarin, Coumadin, I would not suggest taking curcumin. You can talk to your physician about it, but I would say probably stay away from curcumin. And the reason is that curcumin as an anti-inflammatory can thin the blood a little bit. That can be a good thing, but if your blood is already too thin, you don't want to make it even thinner because then you may have problems with clotting and some bleeding stuff. So there are some people who should not take it, and that's one big thing. If you're taking a lot of daily anti-inflammatories, like if you're taking aspirin and stuff every day, you may already have too much anti-inflammatory stuff on board and your blood may already be thin enough. And again, you don't want to take something else to make it even more thin. So that's something your physician can look into that. There's ways to test that. Also, let's see, anyone else that shouldn't take it, if you have a liver disorder, probably should not take this. I have seen it suggested that curcumin can help liver disorders, but I have not seen enough to recommend it for that use. I don't recommend that. I would say that, your liver breaks down curcumin. It's metabolized by the liver, and curcumin will put a load on the liver. And so if your liver is kind of taxed already, if you have liver issues, if it's not working at 100%, this could put too much of a load. If you're taking a lot of other medications or you have cirrhosis, stuff, this may not be something to take. Other drugs are processed more by the kidney, but curcumin is definitely a liver metabolized drug. So your liver should be healthy. It's very easy to do liver tests and make sure that your liver is up for taking a new medication. That should be part of your yearly exam anyway. Pretty simple to do. So I would suggest checking and making sure that your liver is in good shape before taking really any new drug type thing. In terms of what to look out for, look for, if you see your skin getting yellow and your eyes, the white of your eyes turning yellow, that's not the curcumin dyeing your skin. That's jaundice. And so if you see yellow, that means that your liver has been overtaxed, and you should go to your physician and find out how to deal with that. And you will probably have to stop taking a few things. And that would probably involve stopping curcumin if you just started taking that. So where do you get it? So this stuff is everywhere. Finding the best source is a bit difficult because one of the big problems with botanicals is there's not a lot of regulation on the purity of what's in the bottles that you buy. And so there are good things out there and there's some really bad ones out there, and it's really hard to know the difference. So you really have to do the research. I can't recommend particular products because I can't affiliate myself with companies. Now, what I can do in this case is tell you what I use in my research, and that's because I have to publish what I use when I publish scientific results. And so I have papers that are already published and they say what company I use for these studies. So I can't tell you that. I don't particularly recommend them to you, again, because I can't, but I can tell you that's what I trust using. So you can take that as an endorsement. It's what I use. So you can take that for what you want. I use Pure Encapsulations, and I've used them for about 7 years. And they're a company that meet my criteria for doing a really good job of ensuring purity and stability of the compounds they make. So that's Pure Encapsulations. I would suggest if you do order from them, make sure you're getting it from Pure Encapsulations proper. If you're ordering from an online company, it's possible they may have a fake version. I don't know of anything like that happening, but I wouldn't be surprised. And so just make sure you're getting the real thing if you use them. But anyway, I think in general, getting curcumin from that company has worked out very well. And I get my compounds tested independently to make sure that what is said to be in there is actually what's in there. And that's a big deal in botanicals. You can't be guaranteed that all the time. So which formulation to get? There are lots of different attempts to increase the potency of the curcumin. And the big thing is increasing the bioavailability of the curcumin. Curcumin, unfortunately, when you eat it, it gets broken down really fast. In fact, most of it gets broken down before it even gets into your system. So the chances of enough getting into your brain where you might need it is very low. One thing that helps the bioavailability quite a bit is taking a piperazine. Usually that's black pepper. So adding black pepper to curcumin drastically increases its bioavailability, which is typically what we want with this. Now, I think most of the compounds or products that you find now will already have that in there. So you can look at the back, it should say curcumin, and then it should have, say, something like black pepper or piperazine. Now, there's a lot more, I'm seeing a lot of new formulations to try to aid in bioavailability, and they may work even better. That's possible, but I don't know. I haven't used them, so I can't recommend those kind of newer techniques to increase that bioavailability. But do some research on that, and maybe one of them has emerged as superior. So one question is, can you just take turmeric? Why take isolated curcumin? Some of the quick answer to that is generally not. You can't just take turmeric to get curcumin if that's your objective, and that's because turmeric is only about 2% curcumin. So if you're wanting to get 1,000 milligrams per day of curcumin out of turmeric, you would need to eat about 50 grams of turmeric. And if you look in your spice bottle, it's probably about 50 grams of turmeric, which means you'd have to down somehow one of those bottles of spices every day. And that's too much to ask. I think it's a nice spice, but I don't want to be eating 50 grams, and that would probably be too expensive anyway. So that's probably not the right way to go. Now, there's a lot of evidence that turmeric itself can be helpful. I have not researched turmeric, but you might find that you want to go a turmeric route instead of using curcumin as an isolated substance. But again, I haven't looked at that. You can do some research and see if that's something you might want to try. There's teas and different ways you can take that. So I am including a link below to a paper if you want to see the way that I use curcumin and the types of effects it has on chronic pain and fatigue. I'll put a link and you can access that paper. It's a scientific paper. It's not an overly complicated scientific paper. And generally what you'll see is it seems to help chronic conditions with pain and fatigue about 20% on average, but that's with everyone thrown in. That's responders and non-responders. So 20% doesn't seem like an amazing reduction of pain and fatigue, but again, because it's non-responders and responders, overall, it's not exciting. But for the people who do respond, they're getting about a 40 to 50% reduction of their symptoms, and that is exciting. So if you can have your pain or fatigue, that is definitely worth taking it. So you can look at that in the paper if you want to. I'm going to be running larger trials. I've only done very small trials to kind of screen these compounds, and now that I've found a few like curcumin that do seem to work, I'm going to be running much larger trials to be able to say more confidently that it's something that people should be taking. So keep an eye out for that. So bottom line, I cannot tell you that curcumin will help with your fibromyalgia or with your ME/CFS or your other chronic pain or fatigue disorder. I do think it's going to help a lot of people and with different types of versions of chronic pain and chronic fatigue, but we don't know for sure. I have to run the clinical trials before I can ever say it is likely to help. Again, for right now, if you have these symptoms and you've gone to your physician and they don't know what else to do, you've got pain, you have fatigue, and you need to do something and you don't know what to do, this is something to consider. I think it's worth a try. Again, it's something that you would have to take daily, like a 500 milligram capsule in the morning and a 500 milligram capsule at night. And you'd have to take it for months and months and see if it works. But if you get a 40-50% reduction in your symptoms, that's definitely worth it again. Last thing I would say is please respect the power of these agents. Remember that curcumin is an isolated compound from turmeric. And so you can't consider it to be this natural compound because it's not. You can't get curcumin just by itself in nature. Turmeric is natural, but curcumin's not. And so when you isolate a compound, now we're more into the drug territory, even though it is something that you can get anywhere. Drug, food stuff, probably your supermarket, it's probably everywhere, but it still actually is a drug. And so, don't make the mistake of assuming that it's that there's no risks in taking it. So I would say for things like curcumin, as opposed to like eating blackberries or blueberries or whatever you want to try to do to help vitamins and help your condition in different ways, this is different. I would say mention this to your physician. Unfortunately, there's a good chance your physician won't know really what to recommend, but at least mention it and just make sure that it's kind of in your records. And do check out the likelihood it will help, and do keep an eye on the caveats that I mentioned, because yes, some people will not have a good reaction to it, like with anything. And for some people, it's just not appropriate for what their problem is. And for some people, the side effects will be greater than the benefits. And so all of those are possible, but it's also possible that it will have a large beneficial effect. And so, yes, I think it is something that if I was dealing with those issues, I would give this a try for 2-3 months and see if it's worth continuing. So that's my advice on curcumin. You can keep an eye on this channel, and I will be covering fairly frequently other botanicals and other potential treatments that I've been researching that look promising to me. So I hope that is helpful. Thanks.